Hello, my name is Christy Sheets. I'm from Compression Management Services and the Comprehensive Care Center for Women. We're a durable medical equipment company that specializes in providing products to patients that suffer from swelling, burn-related injuries, and who are in need of breast surgery products. We have 7 locations. They're all listed on the back of our brochures, which I'll leave with you today, along with a couple of our script pads that have all of our products listed. We have a very simple, easy-to-follow 3-step approach for managing lymphedema. Compress, maintain, secure. Compress with a sequential compression device, maintain with a low-stretch bandage or a contour appliance, and then secure the extremity with a custom compression garment. The pump that we provide and that we recommend at Compression Management Services is made by Lymphopress. This is an optimal. It's completely digital. We program the pump for the patient in our office. So once they take it home, it's very simple. All they do is plug it in, power the switch on in the back, and press start. They're going to use the pump once a day, every day, for 60 minutes at 40 millimeters of pressure. The pump automatically shuts off after an hour. For your patients that suffer from upper extremity swelling, we recommend the Comfy Sleeve Appliance. It's extremely easy to don. You're just going to slip your arm in the arm sleeve. You can unzip the sleeve so that your hand is free. The back comes around to the front, Velcros, and then you zip it up the front. It's really like putting on a jacket. And then you can just zip the arm sleeve closed. The added feature to this pump that simulates MLD therapy is called the pre-therapy or the decongestive cycle. For the first 15 minutes of the treatment session, it will massage the chest, the abdomen, and the back. And then after 15 minutes, it automatically switches over to the sequential cycle, giving more pressure distally and less pressure proximally. It will sequentially move the fluid up my arm and flow freely back to my kidneys and bladder where it can be voided out through urination. Once I'm done with my treatment, I can just unzip the arm sleeve, simply unzip the front of the Comfy Sleeve, and remove the appliance. Like I said, it automatically shuts off after the hour, so it's ready for my next session tomorrow. So once the patient uses the pump, you're going to want to maintain that with either a low stretch bandage or a contour appliance. A low stretch bandage is very important versus using an ACE bandage. An ACE bandage has a very long stretch to it. A low stretch bandage has a very high working pressure and a very low resting pressure. So the patient can sleep very comfortably in these bandages and not have to worry about collapsing the superficial veins. The other appliance that you can use, this one happens to be a 2-piece appliance, is called the MediFit Sleeve and Glove. This, again, is very easy to don. You just slip the glove over the hand, and then you're going to slip the sleeve over your arm. Once you slip the appliance on, then you're going to use the Velcro straps to tighten the appliance down your arm so that it's pretty snug, although you do still want to be able to touch the tip of your nose and the top of your head. This will maintain what the pump has done for you. You're going to wear this appliance about 23 hours a day, only taking it off to use the pump or bathe. We would have the patient do this routine for about 2 weeks, and then we would follow up with the patient and take some additional measurements to assess whether the extremity was fluid-free and reduced at that point. If the extremity is fluid-free at that point, we would measure the patient for a custom compression garment. For your upper extremity patients, we do recommend a 2-piece garment, a sleeve, and either a gauntlet or a glove. If there's any hand involvement with swelling, we do recommend doing the glove. There's several different fabrics as well that you can do for the custom, depending on the severity of the lymphedema. We do recommend, if your patient doesn't have any swelling issues, but they have had any type of breast surgery, we do recommend having a ready-to-wear garment on hand for any type of activity, working out, even just cleaning their home, or if they are going to travel by plane, the altitude can sometimes affect their arms, so we do recommend that for preventative purposes. For your patients who are facing or who have undergone any type of breast surgery, we have a wide variety of products to provide them with. Prior to surgery, we can fit your patient with a post-surgical camisole with drain management. It's a very comfortable camisole that they can go home from the hospital with. And once they start to get up and around, they can house their drains inside of the drain management pouches. This allows them to be very comfortable and mobile as they're healing from their surgery. Once your patient has completely healed, we can fit her with a post-mastectomy bra. There are several different styles and sizes of the post-mastectomy bras. The only difference with a post-mastectomy bra versus a regular bra is that each one of them has a pocket in the back that can house a prosthesis. As far as the prostheses go, there are several different options. This is your most typical silicone prosthesis in a triangle shape. It's filled with whipped silicone. These tend to be a little bit warmer for patients to wear, and depending on the size, they can get a little heavy. If anyone has any neck or back issues, they can aggravate scoliosis or bring on early onset osteoporosis. So we try not to provide these as often as our custom prosthesis. The custom prosthesis is our most exciting and newest item that we're able to offer the breast cancer population. It's done through a 3D imaging process. It's extremely lightweight. It's on average about 60% lighter than a silicone prosthesis. We would fit the patient with a bra that she was comfortable in, and we would take an image of her breast in the bra, and then we would take an image of her surgery site. We can send that scan to the manufacturer. They take those two images and form what they call a fitting form. It's made out of foam, and we would use this as a template for their fitting. We do all of the adjustments in our office, so it makes it really easy for the patient. They only have to come back for that one visit. Once the patient is satisfied with the look and fit and feel of her prosthesis, we can recommend that the manufacturer make the final prosthesis. Now, the patient is extremely involved in customizing this prosthesis. We work with her in choosing a skin tone. There are 16 choices of skin tones, nipple designs, and nipple colors to choose from. So she can really customize the prosthesis the way she wants to. This will only fit her. Because we've scanned her surgery site, the back is made to fit her body like a puzzle piece. The back is also made with a textured type material, and this adds to the grip of the prosthesis. She can have the option of having it made with magnets. They will embed 3 magnets inside the prosthesis, and then they give you 3 magnets with the adhesive discs. So what we would do is we would put the adhesive disc on the back of the prosthesis. The adhesive disc would then adhere to the woman's body, and then the magnets would magnetize together. And this would give her added security if she were going to wear her prosthesis swimming or working out or doing anything active. For any of your patients that have undergone reconstructive surgery, sometimes they're still in need of a partial prosthesis to give them the balance and symmetry they're looking for. So we have a wide variety of different thicknesses and shapes and sizes of partial prostheses that we can fit them with. What we can also do, because of the nipple surgery not being covered by insurances most of the time, we can either cast an existing nipple, or we do have a product line that provides ready-to-wear nipples for patients that don't have nipples to cast.